Welcome to San Diego's most popular local morning news. Good morning, San Diego.
The swine flu is affecting more people all over the world this morning, and everybody seems to be on high alert, keeping a close eye on this outbreak.
And here in San Diego, no new cases have been reported, but obviously people are still concerned. David Davis is live out there right now talking about this. Good morning, David.
Good morning, Dan. Good morning, Sandra. Yes, we are at the airport. We'll talk about the airport and how it's involved with this whole situation in just a moment. But joining me this morning is Dr. Reza Tirgari. He is the Assistant Director, Emergency Room, Alvarado Hospital. He's been gracious enough to come out here to the airport to meet us. Good morning, Doctor.
Good morning, David. How are you?
All the word is the swine flu this morning. What is there any type of alert or anything that the hospital itself is under, just being aware of the situation?
All health practitioners have been cautioned regarding the swine flu. It seems to be a little bit more of an aggressive virus, but this is the flu season anyway, and so we're going to take the usual precautions we would every time this time of year.
If people feel like they're sick, if they feel like they had the flu, do they come to an emergency room? Do they go to urgent care? What should they do?
The correct answer, the short answer is yes, especially certain groups such as the elderly, people above the age of 65, young children. If you develop any of the flu-type symptoms, coughing, fever, body aches, sore throat, the smart thing to do is to seek medical attention and to avoid contact with other people as much as possible.
Now, are there any signs about this flu that differentiate it from the regular flu? What are you seeing with it?
In this country, fortunately, every person who's been diagnosed with swine flu clinically has had the exact same symptoms as with regular flu, and so there doesn't seem to be any difference in terms of the clinical pattern. It's because of the deaths in Mexico that we're a lot more vigilant because of the risk of becoming a pandemic, and I think that's just a good precaution to take.
Let's talk about the symptoms again, because there probably are people home right now here in San Diego that aren't feeling well, and when you talk about it, they start to feel even worse. So go through the symptoms that people should be concerned with.
Without alarming people too much, I think the standard symptoms that people should be aware of are the aching, the fever, the coughing, sniffling, congestion, sore throat, headache, the same symptoms that they'd have with regular flu. However, because we've had 4 cases in San Diego, we have to be vigilant, and so we have to make sure that people go and seek medical attention when they have those symptoms regardless.
And how do you treat people with the flu?
With diagnosed flu, and this is a very important point because you have to make sure that you actually do get diagnosed with the influenza virus, and there is a nasal swab that can determine that. There are 2 drugs that are on the market that your doctor can prescribe for that.
Now, as you said, that's very similar to the regular flu. You were telling me off camera that doctors can't even tell when they just see a patient which flu it is until they actually do go under the microscope.
It's a clinical diagnosis, and your doctor will do a swab of your nose and send it to the lab, which can tell us if it is the influenza virus per se.
Doctor, why do you feel, in your professional opinion, that here in the United States we're seeing much more moderate cases than the actual cases in Mexico where people are dying?
The cases where people were diagnosed in this country tended to be in people who were healthier with better nutritional status, and we had better surveillance, so we actually caught it earlier. The cases in Mexico tend to be people who were sicker to begin with, and so the thought is that those people were tended to have more severe disease in the beginning.
Do you think that there will be more cases diagnosed here in San Diego County, just in your expert opinion?
It's hard to say. I would hope not, but I wouldn't be surprised if there were.
All right, Doctor, thank you very much for being with us. We appreciate it. The doctor, he's with Alvarado Hospital, and he was gracious enough to come out here to the airport. Once again, talking with the county as well, the public health officer, she said that there may indeed be more cases here in San Diego County, that they just haven't been diagnosed. Perhaps they had the flu, they ran through it, it was a moderate case, and in those cases, no one was extremely affected. But we are staying on top of it. We actually are having a news conference down at 10 o'clock concerning Mexican and American officials down near the border. We'll be covering that and bringing that for you tonight at 6 o'clock as well. Dan and Sandra, I'm going to send it back to you. Here at the airport, as a matter of fact, the airlines, just real quickly, the airlines are taking precautions there. If you want to change your flight through Mexico, you can do that without paying the penalty that has been, that normally you would pay. So that's what the airlines are doing.
Yeah, good stuff. Thanks, David.
Thank you, David.
You're welcome.